Why do old joint injuries lead to costly OA treatment? Have you ever wondered why those old sports injuries seem to haunt us later in life? Well, it turns out that previous joint injuries can play a big role in developing osteoarthritis, often leading to expensive treatments down the road. Let's break it down. When a joint gets injured, whether from a ligament tear, cartilage damage, or even a fracture, it can cause lasting harm. This damage disrupts how the joint functions and speeds up the breakdown of joint tissues. For instance, if the cartilage, which cushions the bones, is damaged, it can no longer absorb shock effectively. This leads to irregularities and erosion on the surface of the cartilage. Injuries can also change the collagen structure within the cartilage. This can lead to abnormal cell activity and the formation of bone spurs, which can make joint movement painful and limited. Additionally, injuries can cause thickening of the bone beneath the cartilage and even cysts, which further complicate joint mechanics and add to discomfort. The impact of these injuries doesn't stop at the cartilage. They can also affect surrounding soft tissues like ligaments and joint capsules. This reduces the stability of the joint and increases wear and tear over time. Plus, an injury can trigger low-grade inflammation in the joint lining, which contributes to ongoing damage. These changes often develop gradually, and many people may not notice them until significant pain or stiffness occurs. As osteoarthritis progresses, it can lead to chronic pain, reduced mobility, and functional impairment. Managing these symptoms often requires extensive medical care, including medications, physical therapy, injections, and sometimes surgery. All of these treatments can add up, leading to high costs for individuals. Several factors can increase the likelihood of developing osteoarthritis after an injury. If the initial treatment or rehabilitation is inadequate, the risk is higher. Injuries to weight-bearing joints like the knees and hips are particularly concerning. Individual factors such as age, weight, genetics, and overall health also play a role in how severe the osteoarthritis can become. In short, old joint injuries can lead to costly osteoarthritis treatment because they initiate a series of changes in the joint that cause ongoing degeneration and pain. This often requires complex management strategies to maintain a good quality of life.